I'm Jean, I'm a PA student and I'm here to do your musculoskeletal exam. Would you please take off your shirt, shoes, and socks while I go wash your face? Okay. Okay, I will be inspecting and palpating for symmetry, signs of inflammation, edema, effusions, deformities, or malalignment of bones, tenderness, muscular atrophy, abnormal motions, the condition of the surrounding tissues, crepitus, and the ease of range of motion. So would you please stand up for me and face that wall? Okay, so I'm inspecting the posture anteriorly and posteriorly, noting the alignment of the shoulders and pelvis. I'm inspecting the posture from a lateral aspect, noting kyphosis or lordosis. Okay, and I'm inspecting the area. Could you please turn and face that wall? Oh, like turn.
Oh.
Okay. Okay, so now I'm inspecting the area over the spinous process. I'm just gonna move your hair out of the way. I'm inspecting the area over the trapezius and scapula and paravertebral muscles bilaterally. I am inspecting the area over the sacrum. I am palpating the spinous processes and the paravertebral muscles bilaterally. And I'm also going to palpate the pelvis and the SI joint. Okay. And now you can turn and face this way. Okay. So now we're going to assess the C-spine range of motion. So could you, actually you can look at me. Could you touch your chin to your chest and look up at the ceiling? Okay, so that's flexion extension. Could you look to your right and all the way to your left? Okay. And now could you put your head to your left shoulder? And then your right shoulder. Okay, so lateral bending. And then to test thoracic and lumbar range of motion, I'm going to stand to the side of the patient. We should move up a little bit. Okay, so now I'm going to test flexion and extension. So could you touch your toes? Okay, and stand up and go as far back as you can. Okay. Now rotation, so look all the way to your right. Okay, and all the way to your left. Okay, and could you slide your right leg, your right arm down your right leg and bend to the side? Okay, and the other side. Okay, so lateral bending. And now I'm going to test the TMJ. So I'm going to inspect.
I will now inspect.
Okay. I'm going to palpate. So open and close your mouth. Side to side. Okay, and stick your chin out. And back. So protraction and retraction. Okay. And now I'm going to assess the upper extremities. So I'm going to inspect the area over the clavicle, AC joint, scapula, okay, acromion, and
I'm inspecting the area
proximal humerus.
over the trapezius, scapula, and the paravertebral muscles bilaterally.
Okay, I'm inspecting the arms, so the biceps and triceps.
I am now palpating.
Okay, I'm inspecting the anterior forearm, as well as the antecubital fossa,
I am now palpating the area over
the medial and lateral epicondyles, and the olecranon process.
Okay.
I am
Palpating the sacrum.
palpating the, sorry.
and
I'm
the
inspecting the
sacral
area over the metacarpal phalangeal joints. So could you stick your arms out like this? The carpals, and as well as the interphalangeal joints. So could you just, okay. And now I'm going to palpate. So I'm palpating the clavicle, AC joint, acromion, scapula,
all the way back for spine
and proximal humerus.
Okay, now touch your right ear to your right shoulder for C-spine.
Okay, and now I'm going to palpate the arms, biceps and triceps,
Great. And now
medial and lateral epicondyles, olecranon process, and antecubital fossa bilaterally, the anterior forearm, the carpals,
we can color this out, right?
the metacarpals,
So,
interphalangeal joints, and then the anatomical snuff box. So could you make a thumbs up?
C-spine.
Okay, I'm inspecting and palpating.
Okay, so now.
Okay. And now I'm going to assess shoulder range of motion.
Spin.
So,
Station.
okay. Okay, so now we're gonna assess upper extremity range of motion. So first we're gonna do flexion, so you can follow me.
Okay.
Extension,
It says shoulder active range of
okay,
motion.
external rotation, so like this.
See them?
Internal
All the
rotation,
way up for shoulder
circumduction.
flexion. All the way back. for
Okay, and then
shoulder
abduction, so,
Move your arms in a jumping jack formation for shoulder
okay, and
abduction.
adduction.
Back in front of your body for
Okay.
shoulder
So now we're gonna do
And now keep
elbow
your
range of
fingers
motion.
neutral.
So we have
Lift your fingers
flexion,
to the
so
ceiling
go like
for
this.
Shoulder external rotation.
Extension,
Back to neutral. Now this way for shoulder
Pronation.
internal rotation.
supination.
Now.
Okay, and now for wrists. So
we will be
flexion,
doing
point your fingers to the
wrist
ceiling.
movements.
Extension, all the way back. Radial deviation, so you can relax like this. And put your thumbs out, okay? And ulnar deviation. Okay. And now
So you did
finger,
this, right? So let's go back to this position.
hand range of motion. So flexion, so make a 4 and make a fist. So thumb and finger flexion. Stick your hands out. Extension,
Good job.
okay? And stick your fingers out as far as you can go. Abduction. And bring them back in. Adduction. Now abduct the thumb, so stick your thumb up like this. Bring it back down. Okay, and then opposition. So touch your thumb to your pointer finger and all your fingers. Okay.
You did. Yep. Thus, I'm now going to assess the wrist range of motion.
Okay, so now I'm inspecting the area over the hip,
Back like
the
this.
ASIS and the greater trochanter. I'm inspecting the thigh and knee over the medial and lateral femoral condyles, tibial tuberosity, patella, and patellar tendon. I am inspecting the leg and ankle over the tarsal bones, the medial and lateral malleoli, and the Achilles tendon. So I'm just gonna-
Have you start by making a four with your hands.
And I'm inspecting the area over the metacarpals
We are
and the
proceeding for
phalanges.
finger flexion. Now open your fist.
And now I'm going to palpate the area over
Open your hand wide and spread out your fingers. for
the area
finger
over the
flexion.
hip joint,
Then bring your
sorry,
fingers back to the
ASIS,
action.
medial lateral femoral condyle, patella, patellar tendon, and tibial tuberosity. I am also going to palpate the area over the Achilles tendon,
Bring your thumb towards your fingers.
the medial and lateral malleoli,
And then stick your thumb out.
and
your thumb abduction.
the tarsal bones.
Touch your thumb to each of your fingers.
Okay, and I'm going to palpate the metacarpals
Beautiful.
and the toes. Okay. Now I'm going to assess hip range of motion.
Lower extremities. So I'm going to
So,
have to
just relax.
You're going to lay back down, correct?
Okay, so hip flexion,
Yes. Inspecting the area.
knee flexion.
ACES, the greater
Okay, internal rotation, external
So you're
rotation,
basically going from here, medium, so you
And
said palpate the thigh,
abduction.
but palpate the thigh, the femoral,
adduction.
patellar tendon, the
Okay.
Achilles, right from the
I'm going to do
Achilles
that bilaterally.
So you don't
So-
have to go back there later, and then do the tarsal bone, the medial
Hip
lateral
flexion.
malleolus. Then do-
knee flexion,
So we want
internal
to
rotation.
inspect and then palpate?
External rotation.
And then, as you palpate.
Abduction.
you have to say it At the same time, but when you're inspecting, like you don't have to, you're not gonna
adduction.
Okay, so I would just say I am
Okay, and if you could turn on your left side.
So for the inspection, you could just like read it off.
Okay, and now I'm going to test for extension of the thigh.
Sorry, no, that's no.
Okay, if you turn on the
Okay,
other
so,
side.
sorry, that was really loud. Inspection over the hip joint,
Okay.
pieces.
Extension, and you can lay back down. And that was also flexion and extension of the knee.
Yeah.
So now I'm going to assess the range of motion of the foot and ankle. So we have dorsiflexion, plantar flexion, inversion, and eversion. So again, dorsiflexion, plantar flexion, inversion, and eversion. And then flexion and extension of the toes. So curl your toes towards me and point them at the ceiling. Okay. And then again towards me. And then at the ceiling. Okay, good. So now I'm going to measure the bilateral calf circumference approximately. So if you could bend your knees.
The greater toe, which is over here, and I'm doing it like that. So I will say that, and then you will go to where to go down your thigh. Okay. to both inspect
Okay,
and
good.
help the
And could you bend your other
I
knee,
am
please?
going to inspect the area over the hip joint, the ACES, and the greater trochanter, and now I'll palpate that. I'm palpating the area over the hip joint, the ACES.
Okay. And now lastly, I'm going to measure the range of motion of both knees with the goniometer. So you can bend this knee again. All the way?
Okay.
Okay.
Okay, then let's just do, I'll do the full inspection. So
I
I'll
would do that just in case.
inspection and then we'll move on. Okay, cut. Oh, sorry. I am going to run to the inspection. of the
Okay, so
extremities,
130.
Inspecting the area.
You can straighten that and then bend the other leg.
ACES,
All the way.
Greater trochanter. I'm moving down the thighs. I am inspecting my patient's.
Okay, and 120.
No,
You can
you're
relax.
good.